Well, good afternoon, everyone. I just wanted to welcome you and thank you for attending this CME event. And my name is George Monks. I'm president of the Oklahoma State Medical Association. We really appreciate your time. And it's my great pleasure to have two amazing speakers on this talk today. And our topic is timely, relevant. And so it is life under COVID-19. What next year holds for OU. And so this probably couldn't come at a better time. Just a couple of housekeeping notes before we get started. I want to thank one of our sponsors for this event, Plyco. Really appreciate you sponsoring this event. I also want to thank OSMA CME manager, Sandy Deba, who's doing just a fantastic job, but also other staff members that made this, pulling this event together possible, which is Sharon Westmoreland and then also Jennifer Dennis Smith. Thank you very much. Information on how you can receive this CME can be obtained on our website, which is okmed.org. That is okmed.org. And you can find more information there, including more information about our speakers and copies of today's presentation. With that, it's my great honor to introduce our two speakers. First, we'll have Dr. Joseph Harroz, Jr., who is our University of Oklahoma president. He was unanimously selected by the Board of Regents to be the 15th president of University of Oklahoma, and that occurred on May 9th, 2020, shortly after everything hit with COVID. He is an OU alumnus. Harroz has served his alma mater in various leadership roles over the last 25 years, recently serving as the university's interim president, but also as the dean of the OU College of Law. As president of OU, Harroz has developed a comprehensive strategic plan for OU's future to position OU as a top-tier public research university that fosters a culture of inclusivity, innovation, and excellence. During his 9-year tenure at being the dean at the OU Law Center and the Fenelon Bosch Chair of Law, Harroz helped the college earn national recognition, which included the highest ever U.S. News and World Report ranking by any Oklahoma law school. In 2014, he launched the nation's first ever law school digital initiative, and OU Law became the first law school in the country to achieve Apple Distinguished School status from Apple Incorporated. Harroz began his legal career in Washington, D.C. as legislative director and legal counsel for the United States Senate before returning to Oklahoma to practice law with the Oklahoma City law firm, Crowe and Dunleavy. A native Oklahoman, Harroz graduated Phi Beta Kappa from OU in 1989 with a Bachelor of Arts in Economics and a minor in Zoology. He earned his JD in 1992 from Georgetown University Law Center, where he was also associate editor of the Journal of Law and Policy in International Business. Our second presenter today is Dr. Dale Bratzler, who was recently appointed as the OU University COVID officer. He's also the professor and chair of the Department of Health Administration and Policy at the Hudson College of Public Health and professor in the College of Medicine at the University of Oklahoma Health Science Center. He currently serves as the University Chief COVID Officer and also the Enterprise Chief Quality Control Officer for the 3-hospital health system and faculty practice at OU Medicine. His experience in healthcare quality improvement includes working with CMS on the development and maintenance of national performance measures used to profile and report on the quality of inpatient and outpatient healthcare. He has served 2 terms as president of the American Health Quality Association and is a past member of the Agency for Healthcare Research and Quality National Advisory Council and the CDC Healthcare Infection Control Practices Advisory Committee. He's given over 600 lectures nationally on healthcare quality topics with a particular emphasis on the prevention of surgical site infections and adult vaccination. He is board certified in internal medicine. He is a Master Fellow of the American College of Osteopathic Internists and a Fellow of the Infectious Diseases Society of America. With that, we'll begin our formal presentation. What we plan to do is we'll have OU President Harroz go first, and I know he has a time commitment after this, so he may not be available for questions. We'll see how things go, and then we'll have Dr. Bratzler give his talk, and then we'll open it up for questions. If you do have questions, please use the live chat function on the YouTube channel here, but remember, this is only available during this live broadcast. The faculty, OSMA, CME Planning Committee, reviewer, and moderator have no relevant financial relationships to disclose. The OSMA CME manager has reviewed all information and has resolved all conflicts of interest if applicable. So President Harroz, the floor is yours.
All right, thank you, Dr. Monks. Appreciate it. And as someone who ran a law school for 9 years, it is the ultimate honor to be on a stage where I'm part of getting continuing medical education credit. My father's a long time, he's retired now for some 20 years, but retired OBGYN from Oklahoma City. And I went pre-med all the way through school, and at the last second, made the move to law school. But it's an honor to be here. I've already declared this my version of doing my first grand rounds, and please don't correct me because I'd like to live under that delusion. So the topic is one that we're living in real time, and this idea of where are we? What has happened? What is life under COVID, and what does the next year hold for OU? As many of you know, OU has 3 campuses: Oklahoma City, Norman, and Tulsa. And so we look at this question through a number of perspectives. First, as a healthcare provider, and you all have lived this with OU physicians and the largest group practice in terms of numbers in the state, and our affiliation with OU Medical Inc. We've lived in that space with you all in terms of managing the devastation of COVID and all of the uncertainty around how many beds to make available, acquisition of materials, everything from testing, and how you engage in supply chain work that we've never imagined we'd have to do. At the lab level, all the way to making sure you have enough beds for a surge and availability of respirators. So it is a time. There's an aspect of this that fits cleanly into the world you live in, and it's one that we have navigated in a way with which you're really familiar. So there is so much that attaches to that. And continues to attach to that today, that we live in that world, and that is certainly dynamic. Norman campus and our Tulsa campus, Norman campus, non-health science center programs, we reacted quickly. Spring break occurs, and during spring break, it becomes clear that we need to go ahead and suspend all in-person classes. And for the Norman campus, we suspended all in-person classes for not just the balance of the academic year through June 30, but also for our summer courses. Now the Health Science Center picked back up in May after going fully online in March, and has been in that place ever since. But so many unique challenges, and so many that attach to our Norman campus that are specific because on the Norman campus, it is the in-person education is not like our clinical environment at the Health Sciences Center. Obviously, a lot of it is dependent upon being together in large groups, which obviously presents very clear challenges in the wake of a pandemic that is novel when you don't know how it spreads and how to contain it. So lots of questions, a lot of hard decisions ahead of us. For the Norman campus, one of the first big decisions, we made some really good decisions. One of those was well ahead of our cities, any city in Oklahoma. We put in place soon after spring break, over the course of the summer, a mandatory masking policy, which, as you all know, has been absolutely essential to our success. And, one of the key positions, I've been in this job now for 16 months. This is not exactly how they advertise this job, but nothing's been as advertised for any of us over the last since the spring. But one of the things we did was we were able to access, in terms of how we reacted and responded to things, we were fortunate to have access to the OU Health Sciences Center. And one of the first things we did was, turn to that expertise. And And it is really fortunate and a tremendous blessing to have the expertise that exists on that campus to help advise us on how we move forward. One of the things that was truly inspired was the idea of having a chief COVID officer. And I usually brag about him behind his back for fear of request for a raise, but Dr. Dale Bratzler has been nothing short of a hero. And he is our chief COVID officer. He is someone all of us trust, and it's really important. He's put the hard work in and has the credentials and has the credibility and integrity that he's trusted by those of us on the senior most leadership team at the university, but also by those that don't know him personally, but have heard his presentations. And I will not go a minute over on my presentation time that's been allocated, because there's one thing I know, it's where value is, and you'll do much better hearing from Dr. Bratzler. So I will not go a second past my allotted time period. But Dale is someone that we trust. And obviously at a time like this, what we know is we have to be aware of both the science and the rapid evolution of what we know and don't know. But we have to also be aware of the human element to this, which is fear. Right? I mean, there's no way really to run a large organization right now without being keenly aware of what is fact, what is scientific fact, what is evolving fact, because it's all novel. There's a huge element of what I think is diminished when you call it common sense, because it's not very common, but the application of sound, critical thinking skills applied to hard science that exists. But there's also the human element of making sure that you understand what people are feeling and thinking in a time of this much uncertainty that creates this much fear. And pointing Dale to this position, he is the full package. He understands those things. So he moved to a university-wide masking policy, as I said, ahead of the cities in Oklahoma. We required COVID-19 testing for all of our residents in student housing before they could go into our student housing. And it's been fascinating. One of the things that Dale told me early on is that with the protocols we put in place, and that's, extensive social distancing, is modifying our classrooms. All of our classrooms have been modified. We have looked at and explored instructional modalities that are online, in person, a hybrid. We spent millions of dollars on making sure that we invested in, sanitation from MERV 13 commercial hospital grade filter systems. We replaced, 2,800 manual fixtures and bathrooms to make those all automatic. So huge investment in that. Obviously, a massive investment in PPE. But all of these allowed us to be in a position where, net of all of these, the question was, Dale, is it safe to be in our classroom? We saw across the country a lot of universities that went fully online, many universities where they simply thought they could not go in person safely. And in working with Dale and the rest of the teams to put this together, in an amazing emergency operations team, the EOC, Emergency Operations Committee, Dale ultimately said, look, I think that with the protocols we have in place, that our classrooms will be one of the safest places you can be if you're going to leave your house. That's a big statement, and there's a lot of people that depend upon this being accurate. And it's easy to simply say no to things. Just take a look at the Big Ten Conference of the Pac-12 if you follow athletics. It's easy simply to say, no, we shouldn't move forward. But it's also easy simply to sort of, without care, be reckless and say move forward. Our goal, though, is to balance those. And the numbers so far, and I'm knocking on wood and saying a continuing prayer, but right now, if you look at the results, weeks and weeks now into this, we do not have a single case of transmission of COVID-19 in our classrooms on any of our campuses. And at least, I last checked on this on Friday, so I always want to be accurate, but we also have no instances in our clinics of transmission from patient to provider or provider to patient of COVID-19 in our clinical settings, which speaks to the accuracy of the protocols. And that have taken place. And so the statement that our classrooms are safe to date has been true. Now, obviously, the real challenge comes in congregate student housing. That presents a different challenge. And we made sure that every student before they came in went through a test. And if you tested positive, or if you contact traced, we did isolation or quarantine for those students. And we have now some 640 rooms in terms of availability for those that fall into one of those two categories. So, and as of right now, thankfully, and importantly for this audience right now, as of today, we know of no students of ours that have been hospitalized with COVID-19 since classes resumed. So, and we know that obviously tomorrow can be different than today, but the discipline that's gone into this has been incredibly important. We've spent millions of dollars. People have worked tirelessly. I mean, there's a word I didn't use very frequently before the events of this pandemic, but I use it a lot now. There are a lot of heroes here. And so we're moving forward. Obviously, one area that gets a lot of attention is athletics. The two areas that we, the mandatory masking and the protocols we have on campus work for everything, but the two areas that are the biggest challenges are congregate student housing, dorms, and obviously the Greek system, and then athletics. And the athletics piece is pretty well chronicled. 25% stadium capacity, and for the players, it's 3 times a week on the COVID tests. So lots of work on making sure behaviors are good, that we are there are some schools that simply began by throwing students off campus and suspending groups. That's an easy reaction. We're trying to do it stepwise through behavioral public service campaigns, and enforcement is a part of this, but enforcement is a part of this in the right place, so that we're being prudent and understanding human behavior as we approach this. So there's a lot of balancing of interests. What I think is also an interesting macro story as this plays out. I mean, there are a lot of specifics. Every day is infused with how we react to COVID-19. This morning, I spent time working on what are our instructional modalities percentages going to be for next semester on each of the campuses, what do you do about things like spring break? We'll have an announcement on that a week from Monday, likely, on how we handle spring break and certainly Thanksgiving break. So lots of those elements. But one of the things I think that is of interest as well is disruptive change. And I know that disruptive change is something with which the medical community is very familiar. It is something that higher education has been, at least in the aggregate, resistant to. And I think it's fascinating to think about COVID through several lenses. And one of those lenses is the lens of how does it impact higher education? And what does tomorrow look like, and how is it different because of COVID-19? And I think that maybe we'll spend a couple minutes on that. And believe me, I'm looking right at the time to make sure I don't go a second past 12:30, so we don't miss any of the Dale Bratzler's information. But I think it just in a very sort of 40,000 foot look at higher education, really. So in the modern era, post World War II until say 1980, it was sort of a golden era for higher education, public higher education. And we saw obviously the GI Bill, we saw expanding public commitment at the state and federal level, and low tuition and fees for students that went to comprehensive research universities. The next era has been much more difficult, sort of 1980 to say 2008-ish, 2010. And what we saw during that time period was a steady decline in the percentage of funding from states, not just in Oklahoma, but across the country, from the state government. And that burden has been picked up by students. And so now, where it used to be the state that carried the lion's share of the cost of higher education, far and away now it is the student. And there's a cap on that. There's obviously, an elasticity of demand. There's a limit. Even if you weren't philosophically predisposed to try and keep costs low, there's an actually economic supply and demand driven cap on that. So even before the pandemic, we had entered an era of transformational disruptive change. Now, most higher education institutions didn't want to admit to it because that's awkward and hard. And we wanted to think that we were immune, but we weren't. If you look at where universities were across the country going into the pandemic, the macro effects that I talked about earlier had led to real strain on universities. And here's a couple of examples. Pre-pandemic, 1 in 10 liberal arts institutions was on pace to be to go broke over the next 10 years. Among all of higher education institutions going into the pandemic, 30% of institutions were operating in the red. And most institutions' balance sheets have been levered up by taking on increasing amounts of debt. And that's because even though tuition continued to go up, the ability to actually realize that had gone down because the market had changed. And so what has COVID done that impacts that? And the answer is and not surprisingly to this audience, it's a catalyst. It catalyzes the change that was in place. And so credible prognosticators look at this, 1 in 10 liberal arts schools pre-pandemic go broke over the next 10 years. And now they're saying, the catalytic effect of this is it's probably 1 in 5 liberal arts institutions that go broke, and not over the next 10 years, but over the next 5 years. So there are macro forces that are at play here. And at OU, fortunately, heading into this, we asked the question, what's our strategic plan? We had not had a written strategic plan campus-wide or campuses-wide in at least 30 years. So we spent 14 months pre-pandemic working hard on putting together a true strategic plan. Thousands of hours went into it. I thought I knew how to do strategic plans. I learned a lot from this one. And we finally have a strategic plan for the Norman campus. We're getting very close to it for the Health Science Center and Tulsa campuses. But for the first time, and you can find it at ou.edu/live on, is our first written strategic plan. And it lays out our path to the future. And it's a future that has to be adjusted to more quickly because of the pandemic. Now, where do we stand? We stand in really good shape. Again, knocking on wood, a lot of institutions are down 15%-ish on students, lots of furloughs across the country. We projected, had we gone fully online, Norman campus, 3 weeks before school started, we'd lose about $175 million with the 4-year tail. And when you look across the country at universities that went fully online, those numbers we were projecting are really close to being spot on. Where do we stand today? Basically flat. We had expected some big cut, some big decrease in demand. And because of the hard work of so many people, our freshman class is down 2%, transfers are down 3%, but overall enrollment because of retention is up fractionally. And we made some really hard decisions over the last couple of years to get positioned. Now at the Health Sciences Center, it's a matter of aligning the clinical enterprise, which is a big lift and is really a conditioned precedent to execution of a strategic plan there. But Norman campus, we made hard decisions 2 years ago. We cut $48 million in the operating costs. This past year through June 30, we cut $31 million more. And we continue to restructure and invest in the strategic plan to remake where this university is. So, as we look at it, it is a time where COVID is fundamentally engaged in temporary and sustained, really temporary disruption through the length of COVID, but it is accelerating change that was already in the works prior to the pandemic. So that's where it is. This is life under COVID. Life under COVID is, as it is for all of us, it's an everyday effort to try and take the best information we have from yesterday, coupling it with what new information we have today, trying to apply solid critical thinking and experience and hopefully a dose of wisdom to then project how best we balance the need for safety, physical security, and the realities of taking quick and easy actions that could jeopardize economic security of individuals and the implications for that. And also, of course, looking at the institutional impact and needs. So if you like solving problems, this couldn't be a more opportune time to try and engage your problem solving skills. And it tests them across the spectrum. And so, with that, I just want to say that, beyond a partner in all of this is Dr. Dale Bratzler. He has some important information to share with you. I'll be on the call, but I do have to leave in about 10 or 15 minutes for a student event around Unity Week. But proud to be his colleague and thankful to have him. And so I'll turn it back over to Dr. Monks and to Dale Bratzler. Thank you all.
Dr. Harroz, great job. Thank you so much for joining us. I know you'll probably have to leave before we get to the Q&A at the end of this, but I thought your talk was really insightful. It was a very insightful update. And also, I think we can draw a lot of parallels from what you discussed with the disruptive change leading to a catalyst on how we do things. And certainly, we can see that parallel in medicine with the catalyst with telemedicine, for instance. It really fast-tracked that aspect of the way that we practice medicine. And so certainly sometimes disruptive change can lead us into innovation and adaptability. So again, Dr. Harroz, thank you so much. We really appreciate you. And our next person up is Dr. Bratzler. I'll turn it over to you.
So thanks, George. Really a pleasure to be here today. I want to thank President Harroz for the very fine, very nice comments that he made about me. I have to say that I've really considered it to be a really great experience getting to work with the University of Oklahoma. There were a team of us here on the Health Sciences Center started meeting in January. As I've pointed out multiple times, no decisions are made by any individual. We have multiple individuals and teams with expertise that are making all the decisions. And I have to tell you, the leadership team that President Harroz has on the Norman campus has also been just enormously fun to work with, and some outstanding professionals. And I think we're all in this together to try to do the best we can. I'm going to go through the presentation relatively quickly because I do want to get to questions and answers at the end if there are any about some of the operations. I'm going to reiterate a couple of points that President Harroz made. I'm going to talk about some of the things that have happened on campus. Again, many of those were led by members of the executive policy group on the Norman campus. So I'm just going to highlight and show you some pictures of some of the things that have happened in Norman. And then at the end, I want to talk a little bit about the data and the stuff that we're monitoring to try to make sure that we keep our students, staff, and faculty safe on campus moving forward. So from the very outset, President Harroz and everybody on the team knew that we had a first priority for anything that we did, and that was the health, safety, and welfare of the OU community. Absolutely to keep everybody safe. We did not want to see anybody get ill with this disease. We haven't had any hospitalizations or anything that we're aware of at this point, but that's been in the back of our mind. It guides every decision we make. And President Harroz had articulated the vision, and I think it was consistent with the vision for the Board of Regents also, to provide excellent education, but with a predominantly in-class experience. I know that when the campus closed down in the spring, there was a lot of complaints. There were many students, many parents, and others that thought that we really needed to get back to an in-class experience, and yet we knew we wanted to make it to do it in a safe environment. And that meant we had to maintain flexibility for students that were unable to attend in-person classes. So we knew going into this that through the semester, we would have students at some point that would test positive for COVID-19 and would go into isolation. And we wanted to make sure that they continue their learning during those periods of isolation. We knew that we had students on our campus that were immunosuppressed or had conditions that put them at increased risk of COVID-19, and we didn't really want them to feel compelled to be in the classroom if they had those risks. So we had to maintain that flexibility. We wanted to be transparent to the community, to the state, about the impact of COVID-19 on the OU community. And we were upfront. I know many of you have seen and heard about universities around the country that opened for a week and closed. We were, and still talk about, will there be a decision point at some time that we might have to close down some of our in-person experience on campus? But we wanted to make sure whatever decisions we made were based on data, that we were doing targeted. If we had to close something, we did it in a targeted way based on real data. And then we're working very, very closely with the city of Norman, because they are our community partner. The university has 38,000 faculty, staff, and students, and very, very much a big part of the Norman community. So we wanted to make sure that we were working closely with the city of Norman, and we have. I participate, and as well as others from the leadership team at OU, on the Emergency Operations Council for the city of Norman. The other point I make, and I make this to our clinicians on the HSC campus also, we recognized early in our planning that there would be students, staff, or faculty on campus with COVID-19. Just as I met with some of our clinicians here in our clinics this week who talk about all the screening things we do, the questions we ask people, visitors, and others before they come in. But let's face it, it's just like, I remember back when I first started taking care of AIDS patients in my early practice. We finally learned that the vast majority of people out there with HIV at the time didn't know they had it. They were already seeing us in our clinics. We just didn't know it. And the same thing's true of COVID-19. With 40 to 45% of the people who get the infection being completely asymptomatic, that means every single day in our clinics, we likely have some patient, some family member that comes in here who's infected, potentially infectious, that we don't recognize because they screen negative. They don't have a fever. They didn't answer any questions about symptoms. They're completely asymptomatic, but potentially infectious. So one of the things that I've promoted from the outset is this concept of universal COVID precautions. Just assume that anybody you're around could be infected. And that's why we put into place the policies that require physical distancing in our classrooms, that require masks in all of our university facilities and others, because you just have to assume that anybody you encounter could be infected. So we have to do the things that have been shown to prevent transmission of this virus. So I'll spend just a few minutes showing some pictures. This is the website for the University of Oklahoma. And I just highlight on the front page, you see OU Together. It's a place where you can learn about the university's response to COVID-19. I would highly recommend that you take a look at it because we have a lot of resources. This is a little bit small and harder to see, but there's information for student, staff, instructional faculty. Game day policies are on there. And then I'm going to spend just a second highlighting the COVID-19 data dashboard, because we wanted to be transparent about what was happening in Norman and on the OU campus around COVID-19. And so, in fact, this is our dashboard if you go to it. And what you see on the right side of our dashboard is just the usual data that comes from the state health department, with one slight exception. You can use the drop-down menu on the right and see statewide data for the number of cases, 7-day rolling average of cases, and other things. You can also look up Norman data. You can look up Cleveland County data, and you can also look up the 3 zip codes that are right around the Norman campus. And that's the level of detail that we want to watch, because we knew coming in that not all students, if they decided to go get a COVID test, would come to our health center on campus. Some would go off campus to places like urgent care and other places, but they would likely still have their, if they had a positive test, be attributed to Norman, Cleveland County, or the zip codes around the HSC campus. So we watch all of it. And then the stuff that we do in our health center, the Goddard Health Services Center, the number of positive test results, the percent of tests that we do that are positive, and then the number of students that are in isolation, student, staff, or faculty that are in isolation or quarantine. And I just looked this up, as of yesterday, well, this was yesterday when I looked this up, we had 540 people in isolation or quarantine. But when you think about that in the context of the OU campus, the OU community, particularly in Norman, that's about 1% or 1.5% of the 38,000 people that are a part of our community. And then Here on the right, it just tells you the reason that they're either in isolation or quarantine, with the majority being a exposure, most commonly a household exposure or a roommate exposure, and then a positive test in about 180 students that were in isolation. So this was the data as of the 21st. Also, you can go in if you want and see our safe and resilient plan. It's the plan that was put in place to bring students, staff, and faculty back to campus. Again, we wanted to make sure that we do things as safely as possible. So for instance, if we have staff that can complete all of their work remotely, we don't require them to be sitting in a building in an office on campus to do that. We have that flexibility. We're trying to make everything as safe as possible for everybody because our first priority is the health and safety of the people who are on our campus. President Harroz mentioned the mask policy that we put into place. And then again, if you go around the campus and look at all the Heisman winners and other statues on campus, the majority of them are wearing a mask now. We absolutely have a policy, and I will just simply tell you that the students have done a really good job with this policy. In the classroom, on campus, we've had really good uptake of this policy with wearing masks. Everybody's probably aware we had a bit of a challenge with some of the student seating at the football game, and some of those policies were changed for this upcoming game. But by and large, on campus, the students have been doing a very, very good job of wearing a mask. And I walked across campus last Friday, and again, just find people consistently wearing masks. We did all the physical distancing. So one of the things, there were so many things that I never thought about, but the operations folks did. So we have buses that bring people around campus. So we had to limit the availability seating on those buses, which meant we needed more buses, but also meant we needed to hire more bus drivers. So we've done that, and we have frequent buses. So it's kind of like the airport shuttles that you get on. You know, they have limited seating, you jump on, one takes off as soon as its limited seating is filled up, and the next one pulls up and is ready to go. We made those arrangements, and that's worked very well. If you haven't been down to the Norman campus, it is almost eerie because the parking lots are empty. You go across campus, you don't see the large numbers of people because all classes of more than 40 students are online this semester. And that's some of your really big freshman classes and others that simply aren't driving to campus anymore because those classes are online now. This is an example on the right of the classroom, and we have all classrooms physically distanced, which meant we had to take rooms that often had purposes for meeting rooms or other things, or conference rooms, or auditoriums, and convert them into classrooms. And as one professor said, it's kind of like teaching the week before Thanksgiving, when you look out across the room and there's hardly anybody in the room because they're all spread out. They have to be no less than 6 feet apart, and they have to be in a mask to be in the classroom. And that's why, again, I teach on both the HSC campus and the Norman campus, and I feel safe in the classroom because we've made those arrangements for both physical distancing and having mandatory mask policy. We did the same thing for all the eating facilities, all one-way traffic, one door in, one door out. No self-serve, everything is served for you. Lots of grab and go options so that students can walk in, pick up a sack or other food and walk out. But we tried to make all of the cafeterias and everything as safe as possible with minimal contact. There's physical distancing in all of them with markings on the floor, and all of the tables and everything are separated substantially into small tables, trying to separate students as much as possible. We all wear masks in the gym. I can't tell you how frustrating it is to me to see the exceptions that keep getting put into place. Well, we can't wear a mask because we're in the gym. If you're a football player on the OU team, you wear a mask in all training facilities, in the weight room, in all activities. The only time our football players can take their mask off during training is when they're outdoors doing drills where they are separated by more than 6 feet. But that also applies to the university health facilities. Everybody wears a mask whether doing weights or aerobics. We require masks in all of our facilities. And one that I had to learn a lot about was the fine arts. So here's yoga and dancing. You know, they have mask requirements. Choirs, we require masks for the choirs. These are the both men's and women's choirs that are practicing, and we require them to wear a mask because you've heard of the outbreaks that have happened. Also look at the distancing that happens between the students. The other thing I had to learn a lot about was musical instruments, band. So we found masks that have slots that you can put your mouthpiece through for your trumpet or trombone. And most of our, we also found out about masks basically for your horns that go over the bell to reduce any droplets or aerosols coming out of the end of the bell. And there are lots of them out there now. The toughest one was the French horn, because the French horn players, not only do they need something over the bell, but they also have to be able to put their hand in the bell. So they came up with a solution using pantyhose that basically reduces droplets, but also allows them to put their hand in the bell. So lots of things we had to learn. The other point I'll notice is on the picture on the right, you see they're in a tent outside. There are tents all over campus, and many instructors are teaching some of their classes outdoors in the tents that are set up all over campus to separate the students. I'm not going to go through these slides. We do regular daily cleaning. One of the things that came up early on was, we had a student that tested positive. We notified the professor, and they wanted to do intense cleaning of the room. We said, well, we do it every single day, every single night, intense cleaning with electrostatic, cleaning and everything else. And almost every time we got one of those reports, the room had already been cleaned before we even got that report. So electrostatic cleaning across all over the campus. They spent a ton of money on those devices, by the way, and that includes the HSC and Tulsa campuses. In fact, I was teaching last night in the auditorium here at the College of Public Health, and this guy in a spacesuit with an electrostatic cleaner tries to walk in the back door and then suddenly realizes we're teaching class at the time. Something that's been interesting, and I not exactly sure where I feel about this, but something called the Synexa Sphere was put into 2,100 devices were put into residence hall rooms. These are devices that generate dry hydrogen peroxide, which has been shown to kill bacteria, mold, viruses. But also, I didn't realize each device has a HEPA filter built in so that air can circulate through it through a HEPA filter, and also has a UV light to expose the air that's coming through it. So just one more way to try to reduce some of the incidence of infections that might occur in our residence halls. Touchless fixtures and upgraded air filters. President Harroz already mentioned that. I won't spend time on it. We did the best we could. The other thing that the HVAC folks did was increased air exchanges for outdoor air. And hand sanitizers everywhere on campus, with extensive signing everywhere about how to keep yourself safe. So those are a lot of the structural changes that were made. And then I wanted to highlight some of the data-driven choices. So how do we decide if we close? North Carolina made the decision to close after 1 week, but we really wanted to stay open, but we also wanted to do so safely. So how do we stay open? Well, what are the triggers then that might take us to some decision about closing something down? So we're focusing on new cases. How many cases are there identified on campus through our student health center? We have a second testing site on campus now that's run by the laboratory for OU Medical Center. And it is a voluntary, it's principally targeted towards residency, resident housing, but it's voluntary. Anybody can walk up and get a free test. So we monitor all that on campus, but because again, we saw in Stillwater when the sorority had the outbreak, the girls in the sorority did not go to the OSU student testing center. They went to a urgent care and got rapid antigen tests done. We knew that would happen for us too. So we monitor data at the university zip code level, Norman and Cleveland County. I particularly like to look at the percent of test positive just to see what's happening in the community, because I think it's an early warning sign of outbreaks. President Harroz mentioned we've got between 500 and 600 beds. I don't know what the exact number is, isolation bed capacity, but we look at that very closely. But we're also watching Oklahoma City metro area hospital capacity because it might be a trigger. If we saw the hospitals run out of beds, then we certainly don't want to keep students in a setting where they could potentially get infected and not have immediate healthcare facilities available. And the other thing we're watching very closely is classroom absenteeism, whether it's students or faculty that are having to cancel classes because of absences. So here's the data you've all seen, and again, this is data through yesterday, and we've seen pretty much straight line increase in the number of cases in Oklahoma for the past week to 10 days. The 7-day rolling average is as high as it's ever been, over 1,100 new cases a day in the state. So it looks really bad right now. But here's the 7-day rolling average yesterday. I think we went up to 1,185 today, new cases on a daily basis. But I'm watching Cleveland County and Norman and the zip codes very closely. So as of yesterday, there were 212 new cases in Oklahoma County, 173 in Tulsa County, but only 38 new cases in Cleveland County yesterday, where the university is located. So again, even if the students don't come to our center to be tested, that data should still get reported to the state health department and show up in their county zip code or city data. This is the other thing I've been watching quite closely, which is the population-based prevalence of COVID-19. So in fact, this was data through yesterday. Woodward and Craig County had the highest population incidence of COVID-19, but that's because of 2 prison outbreaks. But one of the things I highlighted in some of my press conferences, this is becoming a rural disease. We're seeing a lot more population prevalence of the infection per 100,000 population in rural communities than we are seeing in both Oklahoma County and Tulsa County, where the numbers are actually down considerably. So Cleveland County yesterday was at 31 new cases per 100,000 population per day. Here's Cleveland County data. Again, this is the data I track. So students started moving back to campus somewhere around August 11th, stayed flat for a while. We did see some increase, but it's been relatively flat. So 78 new cases a day in Cleveland County as of yesterday in the 7-day rolling average. And here's the 3 Norman zip codes that are immediately around the Norman campus. So again, that data looks fairly flat. So I think the biggest thing for me is that when you compare these graphics to what's happening at the state level, they look very different. We're not seeing that large straight line increase in the number of new cases in the counties and the county and the city and the zip codes immediately around the Norman campus. We started wastewater sampling. So here's the team, Bradley Stevenson, in the light blue shirt is the lead of the team, Jason Vogel, and then 2 researchers from the Health Sciences Center campus, Katrine Kuhn and Holly Reeves. And we're doing daily sampling of wastewater from multiple sites across campus to detect SARS-CoV-2 in the stool, which could serve as an early warning system for detection of the virus. And I'll just show you. So here we find SARS-CoV-2 in virtually every testing site that we look at. Excuse me. We have one site that many days we don't detect any. But this isn't normalized for anything. This just tells you the number of copies per liter of SARS-CoV-2. It's all done by PCR testing, by the way. So they normalize it by using a virus that's typically found in human stool. It's not pathogenic, but it's very commonly found in human stool. And what we found was, at least on these 2 days, we had one site that was testing that the ratio of SARS-CoV-2 to this other common stool specimen virus was quite high. And so that type of data can help us target individual sites to potentially do additional testing. You can see most of the other sites that they're testing had relatively low ratios of SARS-CoV-2 to the other ubiquitous stool virus. Here's our bed capacity. So this was data as of yesterday. As of yesterday, we only had 22 students in isolation beds on campus, which is very good. And you can see yesterday, the maximum capacity was at 598 beds. So we've got plenty of beds to isolate students if somebody tests positive. And in fact, you've heard Fauci and others say, don't send them home to their parents, keep them on campus, but isolate them until they recover. Of course, this is data on percent positives. This is the Goddard Health Center. So most of the students that go to the Goddard Health Center go there for testing for one of 2 reasons. They've either been notified that they are a direct exposure. So maybe their roommate tested positive, and so they're coming to get a test, or they have symptoms. And so you can see we really peaked around the 1st of September, but ever since, the number of positive tests has actually come down. We were at 9.1% yesterday. We were only at about 3.5% on Monday of our tests that were positive. Again, this is a biased sample of students who come to the health center most commonly because somebody called them like a contact tracer and said, you know, this person that you were around tested positive, you need to get tested. Interestingly, when we look at the 2 reasons people report our positive cases, because we now are doing part of the contact tracing, the 2 reasons that we're seeing positive cases are off-campus events and a roommate, whether in a residence hall or in off-campus housing. And in fact, we find more positive cases in our off-campus housing, and that would include Greek or households where multiple students rent a site, than we do in our residence halls. So here's our residence hall data. And again, we saw this peak in early September, but right now, and this was all purely voluntary testing. Now we're doing some targeted randomized testing, and as of yesterday, only 4.6% of the tests were positive. And if you actually look at the last 2 days where we're doing, this is random specimens from the dormitories, where we were at 3.3%. And then finally, as I mentioned, we do look at total hospitalizations in the state because we do care about the impact we have on the state, and we don't want to continue operations on campus if we see a large capacity problem in the health system in our state. That would be a trigger that might make us close down some of our in-person activities. So in summary, our first priority, again, has been consistently health safety of our students, staff, and faculty. There is no playbook. Boy, this has been a learning experience for me. There is no playbook. We talked to multiple other universities. We participate in all sorts of forums. I've spoken to the State Board of Regents and the President's Council of the Board of Regents multiple times. We have a group of us that are focused on campus opening, trying to learn from each other as we go. But there's no playbook for doing this. We're just all learning as we go. We really do want to keep the campus experience and in-person learning experience intact for our students, but safety and health of the students, staff, and faculty are still first. And we're using these multiple sources of data that we have available, and we're prepared to move online, though we have committed to try not to shut the entire campus down like we did last spring. But let's say we saw a large outbreak of cases, let's say in our residence halls, then we might suspend all in-person freshman classes. Where most of the which accommodate most of the residence hall students. So we might take all freshman classes and put them online, but keep our upper graduate classes, or the upper level student classes open for things like laboratories and other things that they really need to graduate from college. So we want to do everything we do in a targeted way, but based on real data. So George, I'm going to stop there, and I'll be happy to answer any questions.
Dr. Bratzler, fantastic job. Amazing. This was really interesting. Both you and President Harroz did a fantastic job. I want to remind everybody, if you have a question, you can use the chat function on your screen. And again, this is just for the live version. Dr. Bratzler, this was just really interesting to me, sort of not only a behind the scenes look into your efforts and the protocols that have been put into place, but also some really great data and great programs with the OU Together, Safe and Resilient. And then I found it really personally interesting with the band story. I'm a former band guy. And then also the wastewater testing, which I think more and more areas will start to utilize that. So that was really interesting to me. I'll say that with the leadership of President Harroz and your advice, guidance, and expertise, I think University of Oklahoma is in good hands. And so, and from a personal standpoint, Dr. Bratzler wears a lot of different hats. One of the hats that he wears is he helps us out. And so we formed a COVID-19 task force through the Oklahoma State Medical Association. And so he helps to guide us as well. It's just one of the many hats that he wears. We do have a question, Dr. Bratzler. So the question is, was consideration given to ending the semester after Thanksgiving break and having finals online, and then to avoid students returning with potential COVID?
Yes, and I think President Harroz actually made that comment that we're still having that conversation. Part of it was the Board of Regents did not want to jump on that decision too quickly. They wanted to have time to see how we were progressing through the semester. And I think President Harroz mentioned that a week from Monday, a announcement will occur for both. Will we have spring break in the spring semester next year in 2021? And will we close down the campus after Thanksgiving this year? I think OSU has already announced that they're going to close down, and we're certainly considering it. Like I say, I think the point is very good. You send them home, you send them out, and then bring them back. Do we retest them all? Remember, we spent about $750,000 testing all the students before they can move into residence halls. And I think likely would occur again in the spring semester. So we're looking at that, and we'll hear soon.
All right, thank you. Here's another question. Does the Synexus sphere kill COVID, and are they in each dorm room?
Yeah, so it's a great question. So when I first learned about these, I'll tell you, I was a bit of a skeptic. And that comes primarily from my years of research related to surgical infections, because all sorts of places around the country have put into place all sorts of technology to reduce surgical infection. And I always say the Petri dish studies, if you could put a Petri dish in the room, they seem to reduce the bacteria or other organisms that are floating around in the room, but do they actually prevent surgical infection? So I look for that same evidence with Synexus. Synexus has the Petri dish data that shows that the device does kill bacteria, viruses, and mold. And it's my understanding they were looking at the technology, particularly in the older residence halls where they had had some challenges with mold in the past, and felt like they needed to do something to try to address that. At the time I looked at it, I heard about the dry hydrogen peroxide that these devices generate, but I didn't realize they also circulate air, have a HEPA filter and an ultraviolet light for the air that's going through them. So do they work or not? I don't know. I would have loved to see a randomized trial. I know the company has good data on killing things. Will they reduce the spread of COVID-19? I think time.
I'm curious, how large are those units? I mean,
they're actually pretty small. They're probably, think about a like one of the old oscillating fans that people set on. They're not much bigger than that. They're mounted to the wall, or and they circulate air with a HEPA filter, ultraviolet light, and generate dry hydrogen peroxide, which has been shown to kill a bunch of different organisms. So, the one thing I will say, the first day we did random testing of students living in the residence halls, the first day out of the 154 tests, only 3 were positive. I was shocked. I expected much higher numbers.
Okay. I'm not sure I understand this question. It says positive cases, and then it says antigen, antibody, and or presumed.
Yeah, so we're following state health department guidelines. We only count, so if you come and get tested on our campus, you only get a PCR test, the only one we do, except for the football team. Football team gets 2 PCRs a week, but then the Big 12 conference mandated that they use a single company to do antigen testing on the Friday before game day. So all of our football players, well, in fact, all of our student athletes get 2 tests with PCR and an antigen test. But we knew a lot of students were going to urgent care centers. And I was very happy that the state health department now includes antigen tests in their positive. Emmy Labs also is down in Norman, and a lot of students will go there for PCR testing. We don't look at antibody tests at all. Antibody tests are for research purposes only, but they're of no value in diagnosing anything.
Well, thank you, Dr. Bratzler, and thank you, Dr. Harroz, although I know he's off the line. I think I want to be respectful of everyone's time. I know everyone has other things that they've got to do. So I want to thank everyone for joining us for this last hour, and I hope you found it insightful and valuable for you. Again, if you, to log your CME, go to okmed.org. That's okmed.org. And thank you very much. That concludes this program.
Thank you.
Thank you, guys.